My name's Amy. I'm a registered nurse for Dr. Duncan Taylor, who's a plastic and reconstructive surgeon in Perth, Western Australia. Whether you've been newly diagnosed with breast cancer or you've had a mastectomy previously and you're looking at having a breast reconstruction performed, these videos will provide you with the information you need to make an informed decision about what reconstructive option is best suited for you. In this introductory video, Dr. Duncan Taylor will be talking about the three main breast reconstruction options available to patients after they have had a mastectomy. You will learn about implant-based reconstruction, autologous or own tissue breast reconstruction, and a combination of the two, latissimus dorsi, or commonly known as LD pedicle flap, to cover an implant.
My name is Duncan Taylor. I'm a plastic and reconstructive surgeon, and I have a subspecialty interest in breast cancer reconstruction and breast aesthetic surgery. Breast reconstruction is the restoration of the breast, generally after a breast cancer diagnosis, where a breast surgeon would remove the glandular component of the breast, most commonly leaving the skin envelope intact, and a reconstructive surgeon would restore the volume which has been removed from the mastectomy component with a number of different forms. Breast reconstruction falls principally into two categories. The first is the use of a prosthesis or an implant placed underneath the skin after the glandular component has been removed. The second is the use of your own body tissue, which is transplanted from one place, most commonly the lower abdomen, to the defect which is formed from the removal of the breast gland following the mastectomy. There is also a form of breast reconstruction which combines both the use of your own tissue and an implant, which principally is the use of the latissimus dorsi muscle, which is on the back, which is swung around onto the chest, and the implant is placed underneath this. This reconstruction is less commonly used and is principally done for patients that aren't suitable for either an implant only or an autologous only reconstruction. Certain situations, in my own personal preference, where an implant-based reconstruction may be more suitable than an own body tissue transplantation in the first or the primary setting. This principally relates to comorbid factors of the patient or more social factors in relation to the patient's age, whether or not they've started a family, or even whether the psychological components of being given a breast cancer diagnosis may be fairly overwhelming, and the thought of having a more involved reconstruction, though it may be better in the longer term, there's too much at that particular time. So essentially, it's useful to come and talk to a reconstructive surgeon who will be able to go through all of the factors that I've just mentioned. Certain situations, also, the primary reconstruction doesn't have to be the definitive reconstruction in terms of for the rest of your life. An implant-based reconstruction, to start with, can facilitate a period of time where the patient can recover from their cancer diagnosis, potentially even finish adjuvant therapies or therapies which are needed in addition to the surgery for your oncological or your cancer treatment, such as chemotherapy or radiation therapy. Other patient groups which may be more suitable for implant-based reconstruction are where essentially the larger, more complex operation is not suitable, and that might be in patients who are experiencing difficulties from their adjuvant treatment, such as chemotherapy, or they're requiring radiation therapy as a treatment of their cancer, and patients who also not suitable for the anaesthetic period or have comorbid factors which may exclude the ability to transplant a piece of tissue with the microsurgical techniques because of multiple medical problems or cardiac history or smoking history.
We hope these videos have been a valuable resource to you. For more information about what breast reconstruction options and resources are available to you, please visit Dr. Duncan Taylor's website for more information.